Pregnant women are afraid to give birth because of repeated failures on NHS maternity wards. This is according to a couple whose baby died shortly after being born. Allison and Ruth Cooper-Hall's son Giles was starved of oxygen for 21 minutes after staff missed vital warning signs. His avoidable death has prompted them to call for systemic change in the health service as hospitals across England are rocked by maternity scandals. Joining me now is Kim Thomas from the Birth Trauma Association and Emma Doughty, who's head of medical negligence at Slater and Gordon. Thank you both very much indeed for joining me. Let me start with you. Let's start with Kim and maternity hospitals and what's going so badly wrong. Why should it be that there are these avoidable, glaring errors which result in these tragic losses for families?
I'd really like to know the answer to that. Because one of the things we know is that this has been going on for a long time. So back in 2015, there's a report into maternity care at Morecambe Bay that identified a whole bunch of failings, really, such as poor team working, for example, failure to listen to parents, failure to follow guidelines, to follow basic procedures correctly, such as reading a CTG trace. And these things were identified, and there was hope that things would change. And then since then, we've had two more major reports. We've had Shrewsbury and Telford and East Kent identifying very much the same kinds of failings. And now we have an inquiry into Nottingham that seems to be going much the same way, the biggest maternity inquiry in the UK. And this is all backed up by the stories we hear from women about really terrible care in maternity.
And this doesn't even take into account, Kim, does it, the inadequacy in the way that most particularly black mothers are treated, the inadequacy in the treatment that they receive in comparison with white mothers, also Asian mothers, who, fare so much worse in a situation which is already frightening and obviously below the standards required. So you've listed all these different inquiries and all these substandard results, but can you hazard a guess at why? Why should it be that this most delicate, most vital part of medicine with the tiniest babies, the most vulnerable mothers, should be going so badly wrong in this way? Why?
I think part of it is to do with underfunding and understaffing, and that's a well-documented problem, but it's not the only problem. I think it's kind of really easy to blame that, to blame understaffing. And what we seem to have is a culture problem in maternity where there is an attitude that the patient doesn't come first, that we don't listen to women, right. and that things have been done a certain way and they'll carry on being done a certain way.
Let me just bring Emma in because we're running low on time. Emma Doughty, head of medical negligence at Slater and Gordon. Obviously, you've conducted cases. This is something with which you're familiar. Can you describe why you think these sorts of things are happening, Emma?
I mean, we've done some research internally because obviously we deal with lots of these cases all of the time, and it's really quite worrying. And what we think is there's a real failure by the NHS to listen to mum, to listen to the pregnant women, and then the pregnant women, they're in their most vulnerable situation, physically, mentally. Pregnancy really takes its toll, and there's real difficulty in advocating for themselves. So you've got these kind of two competing issues, and I think obviously some of the time it can lead to these traumatic births, and obviously the consequences that go with that for mum and baby.
And so do you think that it would be relatively simple to say what needs to be rectified and achieved, Emma?
I mean, I don't think that's for me to say. I think that's certainly for those who are medically trained and people much higher, high up in the NHS to be looking at that. But certainly, what we do when we're sort of talking to clients, to mums bringing cases, we are saying, look, we are pushing, within the NHS for learnings to take place as a result of your case. Mums find it very difficult to speak out. They don't want to say things about the NHS, they're very grateful for the care that they get. But actually, you know, we do need people to be speaking out, mums to be speaking out, not to be embarrassed about having suffered this care. And actually, I think only when that happens, you know, now all of these scandals are coming out and people are talking, hopefully the NHS is listening.
Well, thank you both very much indeed for joining me. Do you have a frightening experience of giving birth in the NHS, maybe leaving you feeling anxious about having any more children? If so,